Hey everybody, welcome to Ask the Anabolic Doc, starring Dr. Thomas O'Connor, brought to you by his websites, metabolicdoc.com and anabolicdoc.com, both of which you can pick up this excellent book, America on Steroids, A Time to Heal, also available on amazon.com. Joining us all the way, not from Athens, Greece, but Hartford, Connecticut,
yes.
Dr. Thomas O'Connor. How are you?
Beautiful. So good, Ron. How you doing today, man?
Doing well. It's freaking hot. It's hot. It's a hot summer.
Still summertime.
Do you know last month was the hottest July on record ever anywhere? The whole Earth.
I did hear that. Yeah.
So
whatever the politics it is, it's global warming appears to be probably true.
Yeah, it is an inconvenient truth.
Yeah, it probably is.
So I do want to steal your last video on HCG, which so many guys out there use it or have used it or are going to use it. But I did want to touch on something real quick because I wanted your opinion. There's a video that somebody, our buddy Swaminator, who has come up with many good questions for this show, he posted a thread. He wanted your take on this. So I thought it was studies, but it wasn't really. He did point out in another post that one study showed low dose of nandrolone has no impact on lipids, and another showed it did have a negative impact on vascular system. I imagine it's had many, but the reason he started this thread was because a doctor named Robert Carlson, who is or was, I'm not sure what his status is, general surgeon and a cardiac surgeon, he put out a video called The Amazing Benefits of Nandrolone, and in the description of it, it said, using nandrolone plus testosterone together reduces back and joint pain using no significant liver and kidney issues, or causing no significant liver and kidney issues, and avoids the dangerous side effects of pain meds. So he harped a few times on how nandrolone is safe to the kidney and liver, but just for everyone out there who might be thinking, okay, well, my joints hurt, my back hurts, I'm gonna get on low dose. I'm gonna get on, he considers low dose to be 200 milligrams a week. He'll back off to 100 or less if need be, but that's what he seems to start most people on, is 200 mgs of test and 200 mgs of Deca, which he believes together is pretty much magic for joint pain and back pain. But is that sustainable for someone to stay on long term?
No, this guy, I remember, when you first asked me about that, did I see the video in we were talking a few minutes ago.
Yeah.
I remember seeing this guy about a year ago. When I did my decadurabolin, I did a film, I researched on top of the stuff that I know from my anecdotal patients, and then I read, the real pharmacology on it. And a lot of the stuff I start off reading is from Bill Llewellyn's book, because Bill, the real pharmacology and structure, and the history of when it was purchased, and the manufacturing, very amazing, right? 1960s and all this. And then I go into okay, so what does it do for guys, the bodybuilding world and so on and so forth. And I came across this guy. I saw this guy's videos and I thought, this guy's a Yahoo. I believe he's not a doctor anymore, because it's just the regulators took him down. And you can't, I'm not gonna get crazy, you can't live on 400 milligrams of any combined gear a week and think it's not going to. You can.
It's not advisable, but you can.
You could. I mean, guys can do it. How much reserve do you have? When you're young, you could do anything you want. So for decades, right? So it's that amount of steroid. I don't care what combinations it really is. Obviously, it's going to make a difference. But test and Deca, you're going to be bloated as heck. The average bear, you're going to be bloated. Your sex drive could be through the roof. It could be normal. It could be bad, depending on. I just did a consult from a guy that is on a similar combination and on and off, Masteron and test right now, and his sex drive, 10 years on steroids, and his sex drive just, Doc, what happened? It just plummeted. What's the answer? I don't know. His estrogens his estrogens have to be elevated, but total estrogen, it could be a contamination. Yeah. I don't know, start blocking all the estrogens, or how about lowering the doses? Look, no one knows. To live on that much testosterone, not to mention, in addition, 200 milligrams a week of decadurabolin. Yeah. I mean, sure, your joints, and the joints don't always stay feeling good. This is bullshit, guys. This is a bull. I just love to be in your face, because If you're rotator cuff, it might help a little bit in the beginning. Are you going to live on that? No one is going to. And that the studies, you live on 100 milligrams a week of nandrolone deca, of whatever nandrolone product you're doing, with or without testosterone, your HDL is going to significantly go down. So it's not vascular studies. We're talking about cholesterol. But if you have bad cholesterol panel long enough, with or without steroids, you're depending on what your risk ratios look like with your global risks, you're going to plaque in the heart. I had a huge heart attack guy come in this week.
Oh, jeez.
And he's just a 50-year-old guy, but he's on testosterone and steroids. Doc, I didn't even do that much. And he had a massive heart attack. Guys have heart attacks without steroids.
Right.
And steroids, what do? They can make you bloated, hypertensive. No one's going to argue me. They could destroy the cholesterol panel. And if you're living that long with that kind of environment,
yeah,
you can have a heart attack. Where's the rocket science? So that's you can't. That level of steroid, 400 milligrams a week, I end up giving guys about 100 a week, and most men, they feel really good on that.
I mean, he did, to give him credit, because he did say he will adjust the doses on a an individual basis, where some guys will be on like a 3/4 of a cc, some, the nandrolone he puts up and down. I think everyone stays on 200 milligrams, their standard TRT, but you're saying even 100 milligrams of Deca, which to me sounds like very, very little, over time that would tank your HDL enough?
It will tank your HDL right away.
Oh, geez.
It will lower it.
Okay.
I mean, it is what it is. No one's going to argue me, because even a little testosterone lowers HDL. Yeah. But is that going to lead to a heart attack? Every man's got different risk ratios.
So backing up to the Deca being so famous, so universally known as being good for your joints and alleviating joint pain. I agree. How much of that do you think is just the water retention?
No, no one. I swear, I love to. Can someone please give me an answer?
We're doing all these studies. Well, there's a study.
We are excited for that, but there's going to be unlimited studies. But so Deca-Durabolin, it seems like, and there's no randomized placebo-controlled studies on Deca-Durabolin, not to mention for joint musculoskeletal orthopedic surgeons. There's no randomized double-blinded compared to testosterone. There's orthopedic guys in Europe. There's a couple of studies where they did it, and lo and behold, the shoulders felt better. But why? It is, in a layman's terms, it increases the chondrocytes. Remember, it's a steroid, and it might be acting a little bit more like a corticosteroid. So people feel it's an anti-inflammatory. It's increased lubrication, increased water and puffiness in the joints. I love all this. I love it.
We're never going to see the study, but I'd like to see a study in my imagination of joint pain treated with Deca versus, all these arthritis drugs like Humira or whatever, just to see which one's more effective. I'm just curious because.
Well, here's the thing though. Deca-Durabolin is definitely, it's an anabolic steroid. It definitely has effects on lower doses that people appear anecdotally, weightlifters, young trainers, and there's been some legitimate studies on it, that they appear to have less pain, musculoskeletal. It's osteoarthritic pain, right? It's if you have full rotator rupture, right? If you have full rotator rupture, how is that going to reconnect it? I mean, but if you globally have your labrums a little bit torn and beat up and it's inflamed and you have some osteoarthritis and so on and so forth and wear and tear and tendinosis in there, and it's your labrum and your supraspinatus is a little bit beat up, and that's the reality. It's not all just perfectly torn. And then you do physical therapy, you take some meloxicam, you take some non-steroidals, maybe a little cortisone injection once in a while. This is before the surgeons take you to the OR. You're like, I'm better. If you have a frozen joint and you're completely down, but that's when you go to the OR and it's too late. I've seen a lot of guys getting shoulder replacements. I've probably seen like 20 of them. Yeah. I mean, everyone has knees replaced and hips replaced, but I see more shoulder replacements. It's amazing. You're not going to be benching. I have a world level power lifter who was a 600-pound bencher, and he doesn't even he's not going to bench. He just does dumbbells now. You know, so the doctors told him, please don't, with those two brand new, you know, shoulders they gave. But he's like this now. He can go like this. He can get the peas. He goes, you know what? I can get the peas out. I can grab for a coffee cup now. And he's like mid-50s. He's not an old guy, but he was a monster, man. And his shoulders took a beating because he's a power lifter forever. And Decadrobone, he was definitely on and off it. And it really does work great for pain, and it wears off. It doesn't, Doc. It works for a few weeks, or it wears off.
Well, that's basically like what a cortisone shot is. It
wears off.
It wears off. It's masked. You know, I had 3 of them in my shoulder, and eventually I realized it's letting me pretend I don't have messed up shoulder for a couple of months.
Then you're hurting it more, but then you're injuring it more. Yeah. So Decadrobone definitely works for pain and for soft tissue swelling and soft tissue injuries globally, and guys get strong on it too, right? It's old Test and Deca, old school. You can get really strong as hell on that combination. And then, but how much risk are you causing to your vasculature with I just talked to a 52-year-old guy who's got a pretty good calcium score. I mean, he's got a pretty good load of coronary artery disease in his left anterior descending artery. He was like, holy shit, Doc, wow, man. So we have to address that now. And he's going to be on TRT, but 52, come on, everyone's having heart attacks. Men have heart attacks anyway. Sure. What are you going to do? Put it on Test and Deca? I'm just saying.
You're supposed to go, I'm done.
I mean, that's
I know we're moving on. No, okay.
We're done. We're done with that. Fine. I mean, but everyone just wants it. But there'll be I mean, I don't know what to say. Decadrobone is a strong anabolic, pretty well tolerated drug, right? I mean with testosterone.
That's the classic combo that probably more users by far have used together successfully is Test and Deca, going back to the late 60s, early 70s.
That's amazing. But don't they get puffy? Let me ask you, Ron. Don't you get kind of puffy on that combination?
Yeah, I have chipmunk cheeks anyway, so I really can't tell.
No, but isn't that like a puffy combination?
Yeah, you're going to retain some water, sure. I mean, it's an off-season. It's a very cheap, very effective off-season cycle. You know, if someone comes to me and, not that I would give steroid advice to anybody because I'm not really qualified, but they say, what's a cheap off-season cycle? It's very effective. I don't have much money. I said, if you can't grow on Test and Deca, you're probably not going to grow at all. So,
wow.
Okay, so on the channel Anabolic Doc on YouTube, Anabolic Doc, Dr. Thomas made an awesome video about HCG. Watch me mispronounce this, which stands for Human, is it Chorionic?
Yes.
Chorionic Gonadotropin.
You said it.
Okay. So all of my bodybuilders out there, you're very familiar with HCG because most, if not all of you, have used it in your PCT. But the doctor did a good breakdown analysis of the history of the drug, what it's used for. So we'll go over that real quick because I always find it interesting. You always you research this stuff, and we learn some weird trivia about these drugs sometimes. So this stuff was discovered in the 1920s. Was first introduced into the medical world in 1931. So the first source of it was harvested from animals' pituitary glands. Is that right?
Yeah.
Okay. So the first version of it was it actually, did Organon make it way back then? Did they make an HCG?
Pregnil. Yes.
Pregnil.
Crazy.
So this drug's been a prescription drug since the 30s or the 40s?
30. I believe the 30s.
Wow. Okay. So at some point after that, they figured out they could extract it from the urine of fertile women.
Isn't it crazy?
Why can't I just drink? No, I wouldn't want to.
I learned this stuff too. I'm like, this is amazing history.
Urine. This is made from urine. This is awesome. Women's urine, though.
Pregnant woman's urine.
Oh, it's pregnant women's urine. Okay, well that makes more sense. So it had some weird uses. So early on, back in the day, it was used for women for uterine bleeding, infertility, ovulation issues, basically, right? Women that weren't ovulating correctly, and it would I guess it would help them to become fertile and
still does.
Oh, so it's still used for that purpose, yeah.
Oh my God, yeah.
But men, I guess in the 50s and 60s, it came into use for men for
Yep.
A whole list of stuff: impotence,
Yeah.
obesity, depression, angina, heart disease,
Yes.
prostatitis. But they thought this thing could cure everything, I guess.
I love the history stuff.
Was it? I don't know if you know the answer. Was it actually effective to treat all those conditions?
Well, it's increasing testosterone.
Oh, okay.
So, yeah, I mean, indirectly, I assume that's what they were seeing.
I mean, heart disease?
Well, heart disease, I mean, and we thought, until about 20 years ago, even today, testosterone is a black box as far as heart disease goes. The data they came up with saying you see my video on that, when I interviewed the cardiologist about heart disease with testosterone. We reviewed real data, and it's inconclusive. So it's inconclusive, so there's no data really for it or against it. So when you want to proceed with that, it's a man per man thing.
Right. Okay, so today it's only prescribed to men for hypogonadism. Is the only legitimate label use, I guess you'd say?
Well, it's used for women too. It's for fertility, for ovulation, and ovulatory issues with women that are having problems with the ovulation.
And this is crazy. You found out in 1954 they came out with the HCG diet.
I thought that was recent, but that started way back then.
That's crazy. So they were using it, so they would have people take HCG along with a very low calorie diet, like 1,000 calories a day, and there was some interaction that they thought was going to happen between the hormones and the low calories and your thyroid gland. I don't know what they were thinking, but by 1974 the FDA put out its first warning about this diet, and nobody really uses this diet. I've never even heard of this, so clearly it didn't stick. That's it. I mean, it's
never heard of the HCG diet.
No. Is it? I mean, is it still a thing?
Oh yeah.
So they're using the drug along with very low calories. I mean, aren't there a million other drugs you could use that would be, like thyroid drugs or something, I would think?
Yeah, it's just comical with phetamine and, all the amphetamines. We have a whole bunch of new medicines that I don't prescribe, for obesity and appetite suppressants and very complicated drugs, but that's an old school. And yeah, I remember a couple of years ago, 10 years ago, it was so big. And when I was trying to prescribe HCG for my patients, to get them to get them fertile and to get them off steroids, I would try to prescribe to CVS, and the guy at CVS, Doc, we're not going to cover that. And he was very mad and very aggressive to me.
Wow.
I was like, and he said to me, we don't cover that. That's like HCG diet wrecked all this. And I was like, wow.
Wow. Yeah. And interesting that federally it is not a controlled drug.
No.
But in some states it is a controlled substance, which is kind of the opposite of marijuana, which federally is illegal everywhere in this country.
That's funny. Good point.
But here in Massachusetts, Maine, many other states, you can spark it up if you want. Okay, then you went into the peak effect, which is interesting. If you put it into your muscle, intramuscular, it's going to peak in levels in 6 hours, or I guess it's active. It's most active for about 6 hours.
Yeah, kind of peak, yeah.
But if you put it sub-Q under the skin, it's active for 16 to 20 hours.
That comes out of Llewellyn's book. This is, and it's. I supported that with other pharmacodynamic, biologic information from the, like the 1940s and 60s. So, and it is interesting. You'd think it's going to go quicker on the sub-Q.
Yeah.
But I was very careful to edit that to make sure that it was really accurate. And so it's because of the capillary circulation is just going to be greater in muscle versus fat.
Yeah. Okay, so then we went into finally what the meatheads, the bodybuilders out there, use HCG for. Like I said, it's primarily used for PCT after cycle, let's say between cycles. But some people, you pointed out, do use it along with their cycles just to try to maintain testicle volume and fertility.
Yeah.
And would that work? I mean, you'd think the testicle.
It does. Here's the thing. Here's the thing. That's why I got to do the studies, right? Yeah. It definitely works. But it works kind of like the decadrabline. It works in the beginning, and then what happens? Most men will tell you that something changes and they either need more, or it wears off, or they have side effects because of using that with other drugs that they can't tolerate. So, but it does work, it does work, but it doesn't, there is down regulate all the bro science. Some stuff where bro science prevails.
Right.
They all talk about on the blogs and the chat rooms, steroid chat rooms all over the world, that if you take too much HCG, or if you're a susceptible man, or you don't do something right with HCG, either dose or frequency or coming on steroids or off steroids, at a certain point you're going to down regulate, and your testicles will actually really kind of speed up and paradoxically shut down. It's true. I just know this is true because I've talked to thousands and thousands of men that have told me this. But again, some guys will say, "Doc, no, that's not true. They're wrong. You're wrong." There's no one wrong or right. It's that globally, can you look at a phenomenon, but there's going to be a spectrum where some guys are going to exhibit these symptoms and some guys, it's common sense. Most men, no one lives on HCG, Ron. No one.
People do use it for TRT just by itself, though, correct?
Not long, though, Ron. Not. They really don't, though. And it's like, who does? I've been doing this for 15 years. We doctors, like legitimate docs that are using it, we use it either to bridge men off of steroids, because it's legitimately part of evidence-based medicine for recovering a man off androgens. Dr. Lipschultz, right out of Baylor, he's going with 3,000 units every other day.
Wow.
So hey, Dr. Lipschultz, go for it. Great. I think it's a little too much. And that's a conservative urologist at Baylor. Now, that's great. We're in a good place now, okay? That's my evidence-based support. Now, beyond that, you'll see other regimens all over the board, but you're using it when you're off steroids to blast, whatever doses, 500, 750, up to 3,000 every other day, twice a week, to get fertile or just to cruise through. But it works like a charm for fertility, man. Unbelievable.
You said you've had something like a 90% success rate.
Absolutely.
And this is former steroid users who were having fertility issues.
Yeah, for different levels of being shut down. 10 years, 20 years on guys on steroids for 20 years, and they're 40. I kind of wonder why you want to have a kid. You're 40, but okay.
Because the 20-year-old wife wants a kid. That's why.
That's exactly what it is. So I go, okay, well, let's just put testosterone to the back of the medicine cabinet, and let's give you 2,000 units of HCG, and lo and behold, within a few weeks, Doc, you're the man. And I'm like, okay, they're another guy. You don't need HMG. So it's about it's a steroid user. So his brain and his testicles, those Leydig and Seroteri cells related to his brain, it's not like a regular guy who's a virgin to steroids. It's if you use a guy that's had a very minimal experience. I learned this from the fertility urology guys. Yeah. This is real fertility urology. I learned this very conservatively in the beginning. I was, working obviously with urologists, endocrinologists. I got to work with the real guys. And then I realized they want to work with me because no one really knows anything. And we're trying to recover guys. We're not giving steroids. Guys do steroids. They want to come off because they want to recover. They can't come off because of hypothalamus shutdown. They have anabolic steroid-induced hypogonadism. And this is before blasting and cruising, even today. So you need to offer them a support regimen, and HCG is and if they're like, you put them on testosterone, and you say, oh, but Doc, before we go on testosterone, I want to have a kid, with my honey. And so you go, okay, so before we go on, chronic testosterone, just TRT, let's give you some HCG. And 90%, I talked to a guy this morning or yesterday. Good job, Doc. It worked. It took a few weeks. And then I keep the guy on this is my technique that I learned. I keep a guy on HCG until the pregnancy is into the second trimester. There's going to be no spontaneous miscarriage. Because what happens? Guys are on HCG. They don't want to live on it. They want to go back on testosterone.
Right.
So they're on HCG. And what is happening? The wife, the woman, is pissing on the stick every time she goes to the bathroom. So sooner or later, she goes, aha! And she texts a picture of the positive pregnancy test.
Yeah.
And then they go, yeah! And they celebrate. The guy immediately, this is within weeks of being on HCG, maybe even days. I've seen it. And then he celebrates. He goes back. He goes home and takes a shot at test, and then
sounds like something I would do. Go ahead.
No, I mean these are just thousands of stories, thousands and thousands of stories. So and then the guy, he goes home, and then they go to the OB, and then oh boy, and then within a few weeks, you know, she loses the pregnancy. It's the nature of the world. It's called a spontaneous miscarriage, okay?
Yeah.
And she has what am I going to tell you? And then the guy goes, Jesus Christ, Doc. I got to go back on the shit again. I got to come off. I was just starting to. So my Tom, you know, the O'Connor, the Metabolic Doc regimen, stay on until you're 16 weeks. The pregnancy is viable by an OB, by an ultrasound, and then you can go back on testosterone.
Okay. Now you talked a little bit about side effects. The main one that seemed to be an issue is edema. A lot of people will retain.
Oh my God!
So is that the reason a lot of guys would not want to stay on this for an extensive amount of time?
Very estrogenic. Now, if you're on testosterone, it's even more estrogenic.
Oh boy. So
no, but it's so common sense. It's like these are like idiots. These anti-aging doctors are just, oh my God, Ryan. It's getting every day.
You never have people on test and HCG at the same time.
I do.
Oh, you do. Okay.
They have to twist my arm. There's no way the police are not coming for me for that. I just don't like to do it because it's like shit or get off the pot. You're either using it for fertility or I'm trying to wean you off because you're young and you haven't done much steroids, and we have to ethically give you this drug because it does reconnect your brain to your balls, at least temporarily, and then I have to wean you down. So I'm either doing a PCT protocol based on evidence. Thank you so much, Dr. Basheen. Thank you so much, Dr. Lipschultz. My ass is fully covered. And I've been doing it I'm just telling this is evidence-based medicine. Yeah. Well, I'm in a safe place. If you don't do it, it's malpractice. So, okay, number one, PCT. And then the only other time I use HCG is I said to get a guy who wants to have a kid on HCG. He's usually not on for more than 6 months or 4 months because we get the job done. And then I do have a small number, for full disclosure, I have a small number of patients that say, Doc, I really like to take that small dose of HCG with testosterone. It's like 200 IUs compared to the stuff that the level I give for fertility or PCT. Yeah. It's pales. So small dose, and you take it concurrently with the testosterone, and there are men that say, I like it.
But why? Why do they want to be on both?
To maintain two things. And Lipschultz has it in his literature, but his literature is very novice. It's very novice literature because we don't even have a year of data on a small number of men? That's nothing. I'm talking about 5 years, 10 years. And across the board, there's a lot of bias in these studies because who's coming out of the wings for these studies, which is great. I don't want to talk about my study yet. I can't talk about my studies yet.
That's fine.
You can go to my YouTube and you can see what I'm doing. I have to be very tight. I can't mention my study. You can go on my YouTube and you could watch my video that I was scripted. I'm doing a study. You could go to YouTube and you can see exactly what I'm doing. I can't mention it any other place because it's very regulated. So I'm very happy that I made it to that point. And I'm sure you saw it, Ron, right? You saw that.
Oh, yeah.
So
I shared it, put it on the MD page, remember?
Thank you. I just can't mention it yet. We have to get clearance from the IRB. We have to get clearance, and we're waiting for clearance. So we're just not there yet. So, okay. So HCG, small doses for men. When I started doing this 15 years ago, everyone was doing it. And I was doing it too. Because I thought that's what you had to do, right? You know, and urology guys and endocrinology guys, they were like, good luck. I have no idea what this is. What? HCG?
Yeah.
I mean, fertility urologists know what it is,
right.
But endocrinology doctors, they still don't know what it is, and that's okay. They shouldn't know what it is because they're diabetic experts.
Right.
Or they want to be testosteronologists, they're going to take my course.
Testosteronology 101.
That's what it be. But so HCG, small doses, it does work. But let me tell you the truth. Guys don't end up doing it because they're pincushions. Some men do. And then it wears off. It wears off. Or worse, they say, Doc, my testicles, despite doing the injections, it's going the other way. And my ejaculate, their ejaculate becomes less and less. No, less and less and less.
Oh, no.
And then what do? So they start taking more HCG, and the ejaculate does go up. But then what happens?
Wouldn't you be all puffy if you're taking
Yes,
megadose?
there are side effects. Their testosterone levels are up to 2,000, maybe 3,000. And if you want that, I don't prescribe that. So you see what I'm saying? We don't know how HCG, I think you're never going to see a day where you're going to see TRT with small doses of concurrently given HCG. I think I offer it to men if that's what they like to try. But again, it can cause hypertension because it's going to lead to an increase in edema,
right.
Because it's the whole goddamn kit and caboodle is going to increase estrogen. It's estrogenic because their testosterone's estrogenic. And if you think you're going to, let's just take aromatase inhibitors.
Yeah,
You're a jackass.
Damn it.
You're a deadly jackass now. Now you're gonna have a goddamn heart attack. Ron, I have to get crazy because I do the same thing. I say the same thing every goddamn day.
Well, people
keep.
It
seems like no one.
I mean, it's all tied into the HDL. Is that what it sounds like? Because this is going to tank. Does HCG itself lower your HDL?
Yes, absolutely. Anything that increases endogenous free testosterone is not gonna increase HDL. Yeah. It may hold strong a little bit or go low, and the studies are there on that.
So then you throw the aromatase inhibitor on top of that.
Tank. You can do what you want to do, guys. You can do what you want to do. And if you have risk factors, if you're a walking guy that has enough risk factors, like your HDL is not that high naturally, those are like every single guy comes in, every single one has an HDL suboptimal, under 40.
Wow. I think mine's like a 2. But anyway.
I mean, it's just people. It comes down to here's what it comes down to. I think Lee Priest, because I saw him on some of your. It comes down to. What do you want to do? I mean, do you really don't give a shit? If you really don't care, I mean, it's just like if you really don't care about your heart health, you can do all this stuff. If you really care, really care about your heart, don't do any of this stuff.
Yeah, this is kind of random, but going back to the fact that it's not a scheduled drug, does that mean it's available like at CVS or Walgreens?
No, it's a prescription drug, Ron.
Oh, okay.
It's not an FDA controlled drug. So Good question. What's
the difference? That doesn't make sense to me.
It's like a Z-Pack. You can't, it's like a Z-Pack. It's like an antibiotic. These are prescription drugs that need to be every prescription drug. You need to be a physician until the FDA clears it to go OTC, over the counter.
Oh, so I can't pick it up next to the cough syrup.
No, but remember we talked about insulin. The only reason why insulin is very unique, why insulin you can go to Walmart and get some regular insulin, is because they made the decision, and I agree with the decision. If you're a diabetic and you're in trouble and you're in your car and you're like, I'm not feeling good, honey, and you can go to a Walmart or a CVS and say, I got to get some. You can talk to a legitimate licensed pharmacist. He's going to be able to determine, here's some insulin. Take the goddamn shot right here, right now.
Wow.
So if you can't get insulin, you're going to die.
Yeah. I mean, People would be shocked if they knew how much pharmacists make, but pharmacists they have life and death decisions if they screw up, they'll die.
Pharmacists are badasses. I mean, the whole medical profession is no one does it to get rich. I can tell you that.
That's why you're always very, very. You never put other doctors down, even when they're maybe ignorant or backward in some ways when it comes to the things we're talking about, as far as being progressive with, men's health and testosterone and stuff. You're always very supportive of your fellow doctors because
they just don't know. That's why I'm a testosteronologist, and I didn't realize 10 years ago. It's so complicated. You have to be an internist. I don't, I say all day long, I don't know. Well, go see this doctor. And then if I know something, I start talking like I talk sometimes, which is really, really annoying and aggressive.
It's okay. You're from New York, right? But,
I'm definitely a New Yorker.
I've been working for New Yorkers for many years. I can't complain. So,
that's great, Ron.
It's a pretty big city. I get it. So I think that covers HCG. We don't tell people how to use it because you need to be working with a physician and the dose is going to be dependent to you. But I'll ask Dr. T and he'll say use this much.
Oh, it's funny.
Yeah. Two different shows. I love the contrast.
Oh my God, I see his show. It's just great. It's incredible.
Very different shows, but serving two very important and different needs.
Things are good, man. The numbers are. I mean, the men coming in, it's just unbelievable. But this spate is opened up. It's just so awesome. I'm so happy for everyone. So thank you, Ron. Thank the listeners, the watchers, the viewers, Bleckman. Thank it. We're tearing it up, man. We got the research cooking. We're just cruising right along. It's
exciting times. Yeah,
it's good times, and it's very progressive. There's some doctor I put on my Instagram. There's a doctor in Australia who just made a big announcement. He's going to offer health services for steroid users because he says that they're underserved and that they're being discriminated against, and it's unethical. Wow, this is why I've been. Hey, buddy, welcome to. I started this. I've been doing this for 10 years.
I mean, it's probably the situation isn't great here, but I bet it's a lot worse in Australia.
So I have a lot of men. I do a lot of consults all over the world, right? Because I do every day. I do 2 or 3 a day. So most of them is FaceTime or Zoom or Skype. So, and I have a lot of guys in New Zealand and Australia, and I will say, it's very non-progressive there. It's very backward, and their doctors are very aggressive against steroid users there. I'm not sure much worse than America or the UK, London, the UK. It's just very aggressive, and this guy's taking he's probably not going to last. They're going to probably take him out.
They'll probably put him in prison pretty soon.
I mean, I don't understand. But we're making noise. I mean, the guy.
That's a terrible joke. I hope they don't put him in prison.
I mean, the guy's, he doesn't look like a bodybuilder. Like, he's pretty some skinny, looking guy. He's doing it because he's following me and he's a fan of it. And he's like, I'm a doctor, and what Dr. O'Connor is doing is correct. And we take care of transgender people. Why wouldn't we take care of these? There's a lot more men on steroids than people that may have intersex or transgender.
Right.
Well, why wouldn't we not?
It's a political thing we're not going to get into, but
no, we're not. But I mean, but so I'm my political side is be loving and caring. There's a man you love. He may be on steroids. Let's make sure we give him some attention.
Fair enough.
And I want to keep young men, Ron. I want to keep young. Oh my God, I do so many consults now of young men that are 17 to 19. Ron,
really?
they're on pro hormones and boosters, and they're in trouble. Some of these kids.
Are they coming to you, or their parents bringing them to you?
No, they do consult. They come to me. Come to me themselves. They're watching this right now, and they're watching my YouTube.
You crazy kids out there! I don't give you enough credit. I'm just
trying. But it's like, Ron, look at your kid. Your kid's not on gear.
No, no interest. If he ever does, it's going to be a long time from now.
Wow. Yeah, so it's amazing. So like these kids are 19, 18. Ron, 13-year-olds are going to get testosterone. 13 boys, 13 are going to GNC, Ron, and getting testosterone boosters.
Oh, well, that's fine. That's legal.
Yeah.
No, I mean, it's You know, I did a run line last week with a 23-year-old kid. He just turned 23. He's a classic physique pro named Jordan Plantico. He was 22 when he won 2 shows this year. Totally 100% drug-free. And he won, when he was 18 or 19, he won the IPA World Championships powerlifting. But he's 100% natural. He's 6 foot, 195 pounds, looks fantastic. He's not huge, obviously, but drug-free for life so far. You know, for the time being, he has no plans to use steroids. And I'm not going to put the other guys down, but in Classic, you know, Classic isn't as heavy with the drug use as maybe 212 or Open, obviously, because those guys have to carry a lot more mass. But certainly drugs play they're used fairly extensively in most divisions, including Classic Physique.
Yeah.
But I was happy to see this kid be able to do it. You know, obviously anybody at that level, they've got awesome genetics anyway. But you know, this kid's something else. He's drug free for life, and you know, you could probably talk to him because he was a champion powerlifter as a teenager too.
Awesome.
He only did it for like a year though. He got tired of it.
We have to reevaluate all the steroid use, Ron. I'm just trying to provide a thinking, you know, a place of a safe haven for men that are considering it, or you know, it's a safe place. Yeah. They just have a safe place. You know, what are you doing? Let's show you what's going on. Here's what I feel comfortable with. Here's what I feel comfortable doing as a physician. What I can offer you with evidence-based, and we have more and more evidence coming. So we're in a very good place because steroids, woo, they're not going away, Ron. You know that.
Then you know it's you're doing such good work, and you're trying to get more physicians to get with the program, because the biggest problem with steroid users is they're afraid to tell their doctors they're using steroids.
That's what the guy in Australia, he's doing a study.
Yeah.
Everyone look at I forgot the guy's name. I mean, look at my Instagram. The guy he's got a study, Push or something, and it's something. Yeah, get the guy's name up. I mean, the guy, you know, again, I'm never going to be one of these guys like, oh, I have competition. I want more doctors. I love this. This guy's
okay. So Australian physician, Dr. Beng EU is his last name. I don't know how you would say that. Australian physician. I don't know if you got his Instagram on there. No, I don't think so. But yeah, Beng EU. Yeah, that's his name.
What was the name of the website I copied there, Ron? Share that website.
Roidvisor?
I don't even know what it says.
That's what I got. Roidvisor?
That's crazy. I mean, but they have really very interesting media. Thank you.
Yeah. Interesting.
Anyway, so but there he is. There's a doctor. He's trying to provide, you know, ethical care for men that are taking steroids so they don't die. I mean, get hurt. I don't know.
Yeah. I mean, it's you're getting the message out there. It's definitely you're having an impact on other physicians, which
he's one of. Yeah.
You know, it's good to see because it's going to spread. It's going to spread.
Yeah.
And it's going to take a little time, but man, it's happening. So keep it up, Doc. Please keep it up.
Well, thanks to you guys.
Yeah. And please, all the media outlets you can get on and talk and get the message out there, do it, dude. Keep doing what you do.
I'm just a media guy, man. I love it.
All right, one more time. Get the book, America on Steroids, A Time to Heal, at the doctor's websites, where if you need a consultation, if you're having you know, issues that your doctor can't or won't help you with, you can get a hold of the doctor at anabolicdoc.com or metabolicdoc.com. If you want to check out his excellent videos, that's Anabolic Doc on YouTube. They're very well presented, very organized with footnotes and time codes and everything. He doesn't ramble like I do here, so check it out. And Dr. O'Connor, thank you very much for once again.
Thank you so much, Ron.
Doing what you do.
Another week, man. Thank you.
All right, everybody. Thanks for watching Ask the Anabolic Doc. We will see you next time.